Dr. Dan here with a quick follow-up to my sciatica video. Here are the top 5 things you can do to alleviate your sciatica symptoms right now. So if you've been diagnosed with sciatica, or you've been told that what you're feeling is sciatica, hopefully by this point the root cause has been diagnosed.
You are a stage 4 basic bro.
To best target your treatment. Now, if you haven't already seen my intro to sciatica video, the link should be in the description below. And as always, the information in these videos is intended for educational purposes only, and that you should consult your doctor first before attempting any of these exercises or activities. Let's begin. So right now I'm going to show you 4 easy at-home activities that you can do to help alleviate your sciatica symptoms, focusing on the 2 major causes of sciatica, lumbar disc herniation and piriformis syndrome. Now, for my disc herniation patients, one of the most common things I prescribe for them is something called nerve flossing, which is exactly what it sounds like. Basically, the nerve is glided through the openings in the lumbar spine, as well as along the path that the sciatic nerve travels from the lumbar spine down into your leg. Basically, if there's any adhesions or restrictions or sticky spots along the way, those areas are able to be mobilized or moved around in order to allow the nerve to move freely. As well as there's any areas of inflammation along the nerve, it helps kind of flush that inflammation out. So to begin, you're going to want to find a platform or a seat that's elevated off the floor that allows you to hang your legs off of it. So position 1 is you're going to have your affected leg, for instance, let's use my left leg for example, positioned backwards underneath the chair or the platform with your nose pointed downwards. Then you're going to want to flex your neck forwards, okay, and adopt this type of flex neck position. From here, you're going to want to come up in a slow and coordinated movement with your leg extending upwards as well as your head looking upwards. So coming up together, and when I use this with my patients, I like to use the cue, nose and toes pointed to the sky. And then back down nice and slow. So ideally you'll be holding each of those positions for 5 to 10 seconds and then complete 3 sets of 10 repetitions of that movement 2 to 3 times daily. Now, very importantly, it may feel uncomfortable while you're doing it, but it should never be painful. That's the intended purpose of this exercise. It's not to necessarily feel sore or aggravated afterwards. It's simply to get that nice gliding motion for that nerve. Activity number 2, press-ups or prone extensions. Recognizable as the Cobra yoga maneuver. Begin on your stomach with arms flat along your side. Then raise yourself up onto your forearms and hold this position. After holding this position for a few seconds, further elevate yourself by straightening your arms and keeping your pelvis flat on the floor. You should really aim to let your low back sag down. Hold this position for 5 to 10 seconds, then return to the start position. Complete 3 sets of 10 repetitions, 2 to 3 times daily. As you complete this maneuver, you will likely gradually feel your leg symptoms lessen as you progress, while any back symptoms may or may not feel a little worse. This is normal and to be expected. Activities 3 and 4 are for my piriformis syndrome patients. They include the pigeon or figure 4 stretch, as well as the piriformis muscle self-release. Let's show you how to do those. Sitting on the floor, bring the affected leg forward and bend at the knee, while extending the opposite leg backwards. Make sure your chest is proud and upright. Hold for 10 to 15 seconds and repeat 2 to 3 times. It can also be completed while lying on your back. Again, crossing the affected leg over your good leg and bringing your good leg back towards your chest. This stretch can also be completed while sitting on a chair. Self-release of the piriformis muscle is a delicate balance of gentle pressure and a good stretch. You will require a tennis ball for this maneuver. To find the piriformis, locate the protruding bone on the back of your pelvis, then the firm bony area to the side of your thigh. The area between these 2 points is roughly where the piriformis muscle lives. Now, sitting on a firm surface or on the floor, place the tennis ball under that area and gently lower your weight onto it, allowing the muscle to melt around the ball. Hold that position for 10 to 15 seconds, then relax. Repeat 2 to 3 cycles twice daily. So as a chiropractor and someone who deals with musculoskeletal issues all the time, assessing the root cause of the sciatica is just as important for my patients as is delivering the proper care. So make sure you get it diagnosed properly. In terms of the activities that we've done today, those are intended to complement your clinical treatments, which may include spinal manipulation therapy, as well as myofascial release to the involved muscles. I'll be addressing each of those topics individually in a future segment. Thanks for watching. Go ahead and share this video with someone you know is struggling with their sciatica symptoms, and leave your comments below. Take care, and we'll see you next time.